Antiviral treatment can inhibit replication of the hepatitis B virus, but a medical research team from the Chinese University of Hong Kong said doctors should consider the health condition of chronic hepatitis B patients when prescribing antiviral drugs. That's because the team discovered that one type of antiviral drug can lead to higher bone fracture risks among patients. Mimo Singh reports.
Between 2020 and 2022, about 6.4% of Hong Kong's population suffered from chronic hepatitis B, a liver disease caused by hepatitis virus infection, or HBV. To treat the disease, doctors often prescribe oral antiviral drugs, with endacavir and tenofovir disoproxil fumarate being the most commonly used in the city. While the drugs can inhibit HBV replication, there are downsides. ETV can create a cross-resistance effect with earlier hepatitis B medications. Patients prescribed TTF may experience renal dysfunction and bone density loss. The low density increases the risk of fracture. In the research, medical researchers from the Chinese University of Hong Kong analyzed data from more than 40,000 chronic hepatitis B patients, aged 60 or above, who took ETV and TTF between 2008 and 2022. The team discovered that long-term users of TTF face a higher fracture risk than ETV patients after 2 years of treatment.
Quite unsurprising to see that the risk of fracture between the two groups do not differ a lot in the first 2 years. It is because that the decline in the bone mineral density takes time, and so after 2 years of treatment, we see the risk difference starts to differ.
Quite a significant proportion of them would develop like cirrhotic complication and liver cancers in long run. At the same time, because these patients are getting older, they have many other comorbidity, other diseases, so their risk of having either complications from the liver disease itself or the complication from the treatment will increase with time.
To avoid fractures, the research team said the elderly can take several measures, such as consuming sufficient calcium, vitamin D, and protein to support bone health and muscle growth. Mimo Singh, TVB News.